We already talked about some basic principles about body language, and now we're going to continue with that. Very simple but very important principles about body language. Hello everyone, welcome back on this channel. My name is Kafi Sheikh, I'm a medical student. This channel is all about giving other people hope through better communication in the field of medicine. First tip is learn how to read universal tells. That means those are some specific tells. It doesn't matter who's gonna show it, it's always the same. Regardless the culture background or the country you're living in, it's almost, not every time, because some cultures have big or very little differences, but there are some tells that are universal regardless who you are or where you live. For example, pressing the lips, like this. Pressing the lips is an indicator for very big discomfort. It only appears if something happens which the person doesn't like or just feels very uncomfortable. So that's something you can look out for. Because if you are with somebody, it doesn't matter why. If you are with somebody and you see this tell after a certain incident or during or while a certain incident, then you know it's something off. It's maybe not big of a deal, don't make it bigger than it actually is, but it's an indication for discomfort in this certain moment. The second tip is about a word that is very hard to pronounce, at least to me, that I need to look up. How to read idiosyncratic tells. Idiosyncratic tells means those are some specific tells that are purely individual to the person next to you or you're dealing with. It means that you need time or you need to know that person much better than just some acquaintance you just saw. You just need to get to know the person much better, so you know the pattern which indicates when this person is now comfortable or uncomfortable. Comfort, discomfort. As you see, there's a very best baseline or the red line through all body language, just to distinguish between comfort and discomfort. And the very important phrase or line you need to learn about idiosyncratic tells is the best indicator of future behavior is no knowledge about the past behavior. As soon you see a deviation from the actual pattern that they show you through body language, it's a very good indicator that something is off or just change from comfort to discomfort or from discomfort to comfort. Now, the next point is about also about normal behavior, or the quote-unquote normal behavior. What is actually normal? Normal is the behavior, as I already mentioned, the behavior they do in their everyday life, like how they open the door, how they pick up the bag, or how they talk, in which velocity they talk, and they play with words, or how they use their body language, their hands, their neck, everything. And once you know their normal pattern, means the pattern they show you in their everyday life, every deviation from this pattern is, as I already mentioned, an indicator for some changes in their mind or in their thoughts, and that's what they showed unconsciously through their body language. So, and the next point is a little bit more difficult and it needs much more practice, and that is to read not just one tell, it is multiple tells. That means a human being doesn't show just one tell. In very specific moments they show many tells one after another. So your mission is now to decipher those kind of body language tells that are coming one after another. But you don't need to think that the person is always showing discomfort tells or tells that indicates discomfort. Many people try to compensate this kind of body language of discomfort with comfort. They are starting to comfort themselves. For example, if a patient doesn't know what you're talking about and shows like this, then it's an indication that this person is now in a very discomfort position, starts to comfort themselves with touching themselves, like on the neck or on the head, the forehead, whatsoever. That's a way to comfort themselves from the station or the position of discomfort. If you see both body language like something like this, then it's an indication that the person is now very uncomfortable about you talking about what the next procedure is, or what you want to do, and the patient doesn't want to talk about it because it can have many reasons. For example, it doesn't want to disturb the doctor with their feelings, with their doubts, with their uncertainty, and so on and so on and so on. The best way for the doctor or for the medical health worker is just break through with questions. Just ask them, hey, I see you are doubting about something, or you're very discomfort about what I'm talking about right now. Is there something you want to talk about? Are you having doubts? Can I help you with that, with something? So that is exactly what you can do to help your patient out, just through body language, and they're going to be very excited about that you already know what they thought about just by reading the body language. The last point and the most important point in this video is that changes, especially quick changes, good indicator for quick changes in their thoughts, in their interests, in their feelings. And that is very important to catch, because if you're telling, for example, a patient a very bad diagnosis, and the patient, you can see literally in their faces that this bad news shatters them into 1,000 pieces. That's a kind of body language you need to look out. It's actually very expecting that the person react like this, especially in those kind of extreme situations. But you can see in many other situations when somebody is comfort and likes to speak to you about the problems and is very open and wants to take your help, and suddenly you talk about a new medication or any kind of medication you wanted to give, and the person just shows body language of discomfort and starts stuttering or doesn't know what to say, and the whole demeanor changes. This kind of quick change indicates that their thoughts, interests, or feelings now changed in a whole other way. And you just can pick this up and say, hey, I see there is something that is very uncomfortable to you, what I'm talking about, so is there something I can help you with? And those kind of breakthroughs or questions who break this kind of awkwardness, those can help the patient out. It shows the patient that the doctor is really listening or trying to help. That's it for today. The next video is all about the limbic system. It sounds very scientific, but it's going to be about the limbic system and some basic terms. As you can see, I'm somewhere else, and I'm going to tell you this by another video. See you next time.